yourself so you know who everybody is. So my name's Jennifer Adam, as you know, I'm the chair and elected member for Ward 3 in Paisley. We'll start with Ian.
Ian McMillan, councillor, and I'm one of the local councillors for Johnson South and Eldersley.
Morning, Fiona Airlie Nicholson. I'm one of the councillors as well, thanks.
Morning, I'm John Matthews. I'm Vice Chair of the Health Board and Vice Chair of the IJB here in Renfrewshire.
Morning, I'm Cadden Jarvis, Chief Nurse in the HSCP. Nice to meet you.
Hi, I'm Lisa Cameron. I'm the Service Manager for Locality Services for Paisley area.
Hi, I'm Stuart Sutton, GP Clinical Director.
James Higgins, I'm the Corporate Business Officer with HSCP.
Morning, I'm Pauline Roby, Interim Head of Service for Health and Social Care Partnership. Nice to meet you.
Morning, I'm David Fogg. I'm Strategic Lead within HSCP.
Good morning, Frances Burns, Head of Strategic Planning and Health Improvement.
Morning, Linda. Laura Howitt, you know me. I'm Head of Mental Health, Learning Disabilities and Alcohol and Drug Recovery Services.
Okay, so there's a lot of names and faces, but you know, you'll time. Well, of course, you will probably will be more familiar.
Sarah.
Oh, sorry, Sarah.
Okay.
Hi, I'm Sarah Levis. I'm the Chief Finance Officer for the partnership.
I've met you before, Linda. I'm Christine Laverty, the Chief Officer. And worker, Mike.
I'm Mark Connick. I'm the Council's Head of Corporate Governance, which makes it the clerk to the board.
Linda, I'm Elaine Curry. I'm one of the committee services team responsible for clerk and the joint board.
Okay, now, and Lisa, councillor, oh, there's a couple online. So Lisa Marie. So Lisa Marie is online, and so is Anne Cameron Burns. Is there anybody else?
Hi Linda, I'm Lisa Marie. I'm Lisa Marie Hughes. I am the councillor for Renfrew North and Braehead and a council member on the board.
And I am Anne Cameron Burns, one of the non-executive board members for Greater Glasgow and Clyde Health Board.
Okay, I think that's us. Right, so now we'll begin. So apologies. Do we have any apologies intimated, Mark?
Yes, we do. We have apologies from Alan McNiven, Stephen Cruikshank and Joan Traynor. Mark Halliwell has sent apologies and Linda Murray is substituting, and Annie Hare has sent apologies and Amanda Walton is substituting. Thanks, Gabriel.
Okay. So the next item is declarations of interest or transparency statements. Do we have any? Fiona?
It's the transparency statement for item 4. And as I mentioned, I Renfrewshire Head Injury Service, and is to let you know that I worked for the organisation that previously delivered that.
Okay, thank you, Fiona. Yes, Ian.
Can I just mention that my daughter actually works for Quarriers, but I don't think that prohibits me from taking part in any debate.
That's all righty then. So the next item is the minutes, pages 5 to 8. So I'll not go through them, but if there's any comments or corrections. Everybody happy? It's an accurate reflection of the meeting? Yes, agreed. Okay, so item 2 is membership update, pages 9. So this will be to acknowledge that at least there's a membership change. If you remember, Councillor Cameron has been replaced now with Councillor Lisa Marie Hughes. So if we just note that. And then I'm looking for a proposal for somebody to take over Councillor Cameron's role in the Audit Risk and Scrutiny Committee. So do we have any proposals? Councillor?
Can I propose Councillor Lisa Marie?
Okay. Thanks. I'll second that. Any other proposals? No. Okay. That's agreed. So we go on to the next item, which is the action log, pages 11 to 12. Okay. So the first item order is the Chair and Vice Chair of the IGB and IGB Audit Risk and Scrutiny Committee submit report to relative appointment chairs and vice chairs for a 2-year period. Report was submitted following the review of the integrational scheme. Do you have anything to add to that? No. Okay. The next item on it is the Renfrewshire's Alcohol and Drug Partnership Annual Reporting Survey. The report will be provided when the details are available. Membership update, submit report to Re-Health Board and unpaid carers representative. Report Re-Council membership being considered at this meeting. And Sustainable Futures Programme Progress update. So briefing will be delivered at the future membership development session. And that's the role in action log. So the next item is the Chief Officer's report, page 13 to 36. There's always so much in this report, you know, but brilliant to see, obviously, we're still performing the best with delayed discharge throughout the whole of Scotland.
There's a few things I was going to highlight.
Yep.
Fair, if that's okay. So the first thing that is in the pack is some details around our performance in Renfrewshire around delayed discharges. We are the highest performing HSCP in Scotland for standard delays. So I'm really delighted about that. The team have worked hard and are committed to ensuring that no Renfrewshire resident remains in hospital for any longer than necessary. That's not to say we don't have some delays, but certainly we're working hard on that. I also wanted to give you a little bit of an update because you'll probably have saw quite a lot in the media around delayed discharges. Scottish Government have got a renewed focus on delayed discharges and looking to get the numbers across Scotland down to pre-pandemic levels. So they are sitting around 2,000 at the moment, and the target is to get them down to 1,410 for Scotland. So there has been a group that's been set up or stepped up called CRAG. That's Collaborative Response and Assurance Group, and that's a weekly meeting with the Cabinet Secretary, and that's only focusing on delays. So there's quite a lot of data has come out in the last week or so, and the Scottish Government have set a target of a maximum of 34.6 delays per 100,000 over 18 adult population in any area at any time. So to give you some assurance on Renfrewshire's position, we have the lowest rate of delayed discharges across the 31 HSCPs, and we're already at our pre-pandemic rate level. So that's not to say that we'll be complacent, but we have given assurances to Scottish Government that we will work hard to sustain our delays at that rate. So there has been no action identified for us as an HSCP. Scottish Government had split it into 3 areas for HSCP. So the first one was major, and that's where major improvements were required. The next one was moderate, and then there was a section for none, and we're thankfully in none. So that's just a short update on delays. In the Chief Officer update, we've got, as requested, I think, by yourself, Jennifer, just a routine update on CAMS. I also wanted to highlight our international recruitment, that we have been working closely with colleagues in the council, and it's an excellent example, I think, of collaborative work that we're now beginning to see international recruitment and people coming through who are now delighted to be working within social care within Renfrewshire. So that's a good development for us. Also, just to advise that there's an adult support and protection inspection. We are anticipating that will begin in January 2025. There's some more updates, and as Jennifer said, there's a lot of information in the report. But I do want to draw your attention to the anti-ligature work that is about to start across Greater Glasgow and Clyde mental health wards, and that includes our own wards. That requires us to decant to a ward in Stop Hill Hospital for probably up to a year. That is not ideal. However, we can't carry out this work with patients in situ and staff. And at the end of it, what we will have is a much safer environment for our patients, but also for our staff. So we've been working really closely with other HSCP colleagues, but also staff side and HR around just ensuring that our staff are supported and not impacted financially with further travel or time. Likewise, we're going to be providing daily transport for families who are wishing to visit their loved one. So that will be daily transport will be, I was going to say every day, but that's what daily means. Daily transport from Renfrewshire to Stob Hill. Just to update on that. And also the last thing I wanted to draw your attention to is some of the challenges we have around recruitment and retention of consultant psychiatrists in our older mental health services. That's at item 4. This is not a Renfrewshire only issue, this is a national issue, but I did want to flag it because apart from it giving us some challenges in how we provide staff, by engaging locums, that does come with an additional cost pressure for the IJB. Happy to take any questions as always.
Okay. I'm pleased to see the CAMS figure there. You know, it's really positive. You know, I know that we struggled for many years, and it was always something as an elected member that our inbox were always full of concerns regarding CAMS. So that's really good to see. Fiona.
Thanks. There's really a lot of good, I think, in terms of that report, and a lot achieved. And so I've just got a couple of questions just for clarification. In terms of the jobs fair and the GPs, I just wondered if we were successful and was there a good outcome to that? I've got another one. Do you want me to just do them both? Is that okay? And my second question was just in terms of the anti-ligature work that's been done. And I wondered if there was a reduced capacity during the move and that would be available to anyone who would require a stay-in. And do we need to consider any additional risk or risk assessment as a result of that? Thanks.
So Stuart can answer your first question, if that's okay, Fiona, and then I'll pass to Laura with the detail around the capacity.
Thanks very much. Yes, so it was successful. We had around 26 GP trainees came along to the event and around 8 or 9 practices. So that was a good number of trainees per practice. And certainly the feedback from practices and from the attendees was that they felt they made good connections and were looking for substantive posts locally potentially. So certainly there's a kind of soft indication that that's a step in the right direction. So we're maybe in the foothills of improvement in terms of recruitment, but won't count my chickens. Thanks.
Thanks, Christine. So in terms of the anti-ligature work, it's a board-wide programme. Councillor Airlie Nicholson and Renfrewshire have 2 wards that were prioritised. So the first one is our Ward B at the Leverdale site, and the second one is our South Ward on the Dyke Bar site. So planning in relation to this work has looked at the phasing of the work, the prioritising, and also looking to the best option to ensure that whatever way that the programme is taken forward, it minimises the impact on bed availability. So there is impact on bed availability. So through this work, there is a reduction in bed capacity of 3 for Renfrewshire. Any other option that was considered would have meant an increase in the loss of beds through, the configurations. So there is a loss to bed capacity. Yesterday I attended a head of service call, which is board wide, looking at how we manage that across the board and how we relieve the pressure. So I think I've brought to IJB before just an update on the bed pressures across the mental health estate, and that's been ongoing, and that has exponentially increased since the pandemic. So we're grappling with that on a daily basis. And our bed managers work really hard in the communication across board to minimise waits for people, but it is something that we've had to consider and look at the risks around that. So it's been managed, but I think it would just be clear to say there is an impact to it, but there's also an impact if we don't manage the anti-ligature reduction work as soon as we possibly can.
Okay, thanks for that, Laura. Ian's next, then I'll take yourself, Linda.
Okay, thanks very much. Just a couple of points and a couple of questions. At 10.2, we're talking about the Renfrewshire integration scheme. It says a total of 4 consultation responses were received. Can you maybe put that in some sort of context? I don't know if 4 is a lot or it's not very much. I think it's also at 15.1 about the Scottish Government saying that a number of posts that are currently funded will not be funded going forward. So can you tell me exactly what that means for us here in Renfrewshire? I think it's worth noting the vaccination programme updates. I think sometimes it's forgotten about that COVID is still a thing and it's still happening. Certainly in the last week, I've heard of about 3 or 4 people who have had COVID. So it seems to be, I don't want to sound alarmist, but it certainly seems to be creeping up slightly. And I think it's a warning to us all that COVID has not gone away. And I'm really glad and really pleased to see the response locally here. And the last point I would want to make is at 21.3, it's talking about the difference between the anticipated expenditure and the funding and income for councils. Is that of concern to us here at Renfrewshire IJB? Thank you.
Okay, thanks very much. Councillor McMillan, can I pass the integration question to Francis? I'll then answer the action 15, if that's okay. And what was the other one that you just said? That Sarah will come in at 21.3, if that's okay.
In relation to the integration scheme, I appreciate 4 responses isn't a high number, but it wasn't unanticipated with this document. It's a really, as you'll know, the integration schemes are really illegal documents. So even when we consulted on the first integration scheme, when IJBs were established, we didn't get a huge response. And this revision of the scheme, there was no material changes being put forward. So we didn't really anticipate receiving a high amount of feedback. The real sort of meaningful consultation happened with the partner organisations in developing the revisions. You're working with legal, the various directors of finance, to look at the word and ensure it reflected any legal changes since the last version of the scheme. We did fully engage with the prescribed stakeholders. We had a survey, we promoted it, but similar to other areas who also were consulting across GGC at this time, there wasn't a large response. In fact, a number of the other partnerships across the GGC area didn't actually receive any feedback at all. Hope that's helpful.
Okay, I'll answer action 15. So just a reminder, action 15 was the commitment from Scottish Government a couple of years ago around increasing the mental health workforce by 800 across Scotland, and every area had a target. I think our target was 27.2, and we recruited a number of new posts into our mental health teams. So we did get some communication very recently from Scottish Government to say that they weren't mainlining, I think it was 4 of our posts, or maybe slightly more, which we were concerned about because they were action 15 and we were under the impression that they would become permanently funded on a, on a recurring basis. So I am liaising with Scottish Government around that, and I do hope to be able to report something a bit more positive around that, because that's staff that are currently in post in our mental health community safety service, and that's been a new service to us in Renfrewshire, and it's been a really well received service, works in the community and can have very quick response times to go out and support people in the community who are struggling with a mental health issue. So I'm very keen, as is Laura, to ensure that we can get recurring funding around those posts. So hopefully I will be in a position to update you on that, but we are trying to get that decision reversed.
Okay, Linda, you're next. So,
Hi, thank you.
Oh, sorry.
The So in terms of the Audit Scotland report, it does relate to the budget set for 24-25. So councils have set their budget already on that basis. So I can't really comment on Renfrewshire Council's budgetary position because it's not mine, but obviously they built in savings plans, etc., in order to deliver a balanced budget and use of reserves, etc. But it's always a lag a year behind. But I think it's worth noting that the position is not healthy in terms of the public sector finances going forward. Hopefully that's okay. Okay, Linda.
Hi, thank you. I just wanted to first of all congratulate the HSCP on the good work that's being done across the board. My only concern and only question really is the update on the CAMS performance. I just wanted some clarification on their 18-week timescale, whether that's an initial phone call interaction with the people concerned, or whether that is the clinicians taking over and actually work being done with the person involved.
I'll let Christine answer. I know I thought I was a bit concerned about that too, because I was worried that it could have been the initial call and they could have been waiting, but I didn't know in the paperwork it said treatment, but I'll let Christine.
It's not the information I'm getting from carers when they're interacting with CAMS that they're well missing the 18-week window.
Right.
So I'll explain a little bit around that. So that target that's been set by Scottish Government is referral to treatment in 18 weeks, and we are 100%. So I think we had some concerns a while ago and we've been working hard, the team's been working hard. That is a clinician saying, so that's a consultation. However, I think what you may be talking about, Linda, is the further assessments like the neurodevelopmental assessments, which there absolutely is a waiting list for that. It's a very comprehensive assessment, and we do, alongside mental health, older people services, there is some challenges around psychiatry and psychology across Scotland in terms of having enough people, enough resource to meet the need. And we have quite an increase in demand for these assessments. So I think that might be what you're talking about, but I can reassure you that it's a consultation within 18 weeks. It's not just a phone call.
Good.
Thanks for that.
I think also what's helpful is the REN 10 programme that we have run out throughout the schools, you know, so that's the plan there is to get in there before it gets a bigger problem, you know, and maybe prevent a referral to CAMS. So I know that I've had good feedback from that throughout my constituency. Michelle.
Thank you, Chair. Just a brief point on the delayed discharges to say well done on such good performance. I wondered, although you don't have any actions with your performance being as strong, have you been asked to provide any support to other boards, either through NHS GGC or through Scottish Government?
So thanks very much for your question. Every HSCP had to put an action plan in recently around what we're doing to improve our position. I have, and colleagues, Karen is online, we have shared our process in Renfrewshire with a number of other HSCPs out with not just GG&C, but out with GG&C, just around what we're doing. So we have shared that for anyone. We've also shown a number of other HSCPs round our team to show them what we're doing and have a bit of a chat. But we also, I have recently been asked to take on the lead for delayed discharges for GG&C. So that's only in the last couple of weeks. So that's some work that I've just begun to around how best to support the other 5 HSCPs in terms of our performance as a board area and not just Renfrewshire.
Margaret.
Sorry, folks. Can I ask a question about the GPIT reprovisioning programme? We've obviously got the primary care strategy coming up shortly as well,
but the update talks about adoption of electronic prescribing in due course. Now, everyone I speak to says that this would be completely game changing and key. Do we have any indication as to when that's coming, and why not sooner? So I'll pass to Stuart for that, but just on the electronic prescribing, as you know, Margaret, I've got the lead for GP out of hours for the board area, and we have electronic prescribing there, which means that we can see someone either on a virtual consultation or virtually, you can see someone and you can prescribe and you can transfer that prescription to a local pharmacy. So that's a great step forward in terms of making it easier for patients. But I'll pass on to Stuart, who's all things about GPs and is absolutely immersed in the IT update that we're going to be getting.
Thanks very much. I think it's fair to say this is a national provisioning, both for the GPIT and for digital prescribing dispensing programme. Both are delayed nationally, and the GPIT reprovisioning is happening kind of imminently in GGC. I think we're one of the earlier boards to go, and Renfrewshire will be one of the first HSCPs, and effectively that means everybody moving to Vision, which is the commercial product that has been commissioned across Scotland. So I think the positives, although it's delayed, are that everyone will be on one system. So that has potential benefits around interconnectivity and sharing of information between and across practices in the HSCP, and with some of our PCIP services potentially not having, as they do now, sort of 27 different logins, and it's very clunky for teams who are working across practices. So I think there's huge potential benefits. The time frame for that should be kind of early part of next year. So I think by the spring we would hope that that's in place across Renfrewshire. There's been a couple of niggles in terms of, I think, servers and capacity, and so that's being worked on before the rollout continues. In terms of digital prescribing and dispensing, we kind of have got a halfway house in Scotland currently, whereby there is an electronic element, as Christine described, to all of the prescriptions that are sent, but there's still a requirement for a paper prescription and a wet signature, and it's finding a way. The DPDP nationally is hopefully going to do away with the need for any paper or signatures. My understanding is that that's been kind of rated red in terms of progress nationally due to some pressures around capacity and funding is my understanding, but certainly I can share links to the NSS website, which has got kind of regular updates on the programme nationally. But it is disappointing because obviously I think this is a key, this would be a key time saver and increase efficiency, and I think it would be beneficial for patients being able to simply go directly to where they wish to collect medication from, rather than having to shuttle bits of paper around the system.
Excellent, thanks for that. Any other questions or comments? Nobody online? Okay then, so can I agree to note the Chief Officer's report in item 4? Item 5 is the Chief Finance Officer's report. I'll hand over to Sarah.
Okay, so this is the final financial report for 23-24. I have to keep reminding myself which financial year I'm in. So, and as you'll see, the overspend was 790,000, and that does include the drawdown of winter pressure monies. So without that, it would have been an overspend of 2.7 million. And I'd like to just draw your attention to a couple of areas within this report. In paragraph 3.4 does highlight the fact that within the annual accounts, we've included a contingent liability. And if you'll remember the work that's been ongoing about the backdating of care at home staff grades, we don't yet know the full impact of that and what that the costs associated with those are. So that's flagged up in the annual accounts. So it's just important that members are aware of that, because that will be funded from the IJB's general reserve. So that will have an impact. I don't yet know what that will be because we're working through that. And then if we move to section 8, the IJB's asked today to approve proposed increases to reserves, and those are detailed Those are Scottish Government ring fence monies, and they sum 2.8 million, and also funding carried forward for specific projects where we're already committed, and that's 198,000. In addition to that, as part of the budget agreed in March this year, the IGB approved the use of reserves to deliver a balanced budget. And in order to do that, we need to repurpose some of the earmark reserves, and those are detailed in section 8.7. So the IGB's asked to approve those as well. I won't highlight any more details, but happy to ask any questions.
Okay, do we have any questions? Max.
Thanks, Sarah. The report's really helpful in setting out where we're at with everything. It's really just a point of clarification with the repurposing of reserves. Does that 6 million transfer effectively go into general reserves, or are you looking to put any of those into any specific earmarked reserves? So it's just to clarify that. Thank you.
Yes, I'm going to create a new earmark reserve specifically for that, and it'll be called Funding to Deliver Balanced Budget. A bit basic, I know, but it says what it says on the tin. So just to make it really clear to the IGB that that's what that is for.
But to all intents and purposes, that is general, but it's got that tag. Thank you.
So, if there's no more questions on Sarah's report, we'll note the year-end financial position for 23-24, approve the proposed transfers to earmarked reserves in section 8.6.1 and 8.6.2 of this report, and approve the repurposing of the reserves in section 8.7. That agreed? Agreed. Okay, item 6 is the unaudited annual accounts.
Okay, so firstly, apologies for everyone receiving this late. I'll explain why that is. Before we can send the accounts out, the Audit, Risk and Scrutiny Committee have to approve the governance statement. So that was on Friday last week. So as soon as that was approved, we then managed to put that into the papers and get them out on Monday. So that's why it was a separate paper. So apologies for that. It's just the time lapse. So there's not a lot I can actually do about that. So just to highlight that. So today you've got the accounts with you. Again, it's quite a substantial document. So I just would like to draw your attention just to a couple of issues which are slightly different to in previous years. So on page 53, there is now a detailed note to the accounts, and that's on the going concern, and that's just more detailed. That's following discussion with external audit. Given the financial position we're in, they wanted more detail on the going concern. So that's really important that the IGB is aware of that. And that will be something that they'll look at as part of their wider review of the accounts. In addition to that, as highlighted in the previous report, there's also an additional note, note 4, and that's the contingent liability in relation to the care at home staff regrade. So that's all that I want to draw everybody's attention to today. But again, happy to take any questions and to note that this is the version that will go to the auditors who will commence their audit right away, following it approval, that is.
Okay. Any questions?
Thanks, Chair. Thanks, Sarah. It's really just, I guess, to update from Audit and Risk that there were questions and discussion raised about the point around going concern, and really to challenge some of the additional risks that have been raised around that, given the position that all IGBs are in, that we really wouldn't be in a position to have a budget approved any further than May or March next year. So it was just really to flag that we had that discussion with the auditors at the Audit, Risk and Scrutiny Forum last week.
Thanks,
No
Max.
question, but thank you.
Michelle.
Thank you, Chair. Just a brief question on the note on related party transactions. I know it's probably not material in the sense of the financial value, but I wondered if it was worth considering any transactions between the board and the healthcare charity, the Glasgow Endowment Fund, if they provided any funding to the partnership this year. Just the Glasgow, Greater Glasgow and Clyde Endowment Fund.
Endowment Fund.
The healthcare charity. Just myself and Margaret both sit on that as trustees, so it might be worth considering.
Thanks for that, Michelle.
Yeah, that's not been raised with, we have discussed that in the past with auditors, and it wasn't felt that it was required to be in because it was part of the related party transactions with the board. So certainly I can raise it with the auditors again to see if they would want that separately, but the only one they'd raised previously was the Scottish Government note, which is now in the accounts, which wasn't in before.
Okay. No other questions, comments? We'll go to the recommendations then. So approve the subject, the audit and annual accounts for 23-24. Note the Ernst & Young and to complete the audit annual accounts in line with the timescale indicated in section 5 of this report. If that's agreed, that's item 6. So we go on to item 7, which is sustainable futures update and proposed next steps. That'll be yourself, Frances.
Yes, that's me. So this paper provides an update on the Sustainable Futures programme, noting the savings delivered to date, the ongoing programme activity. Also provides a summary of the key associated risks and challenges facing this programme. So reflecting the current position and also our learning to date, this paper proposes a range of next steps to support the IJB address its continued projected financial gap. So I just wanted to briefly touch on these next steps, which are set out in section 7 of the report, as we're asking for the IJB to approve these today. So firstly, we're suggesting that the officers assess all the budgets within the HSCP to identify influenceable spend, so that members of the IJB have full oversight of where savings can be applied. Also taking account of what's influenceable and also our statutory duties. We are recommending that we model how an equitable approach to applying the savings across the breadth of our service could work for IB's consideration. In line with our commitment to meaningful stakeholder engagement, we're looking to refresh our approach around that. There's new Scottish Government Planning with People guidance, which we will look to reflect. We also want to take account of lessons learned from the Sustainable Futures programme to date. And we're also recommending that we work with Health Improvement Scotland HIS to get their expert advice and assurance around a refined approach, which we would bring to the IJB for consideration. We'll also continue our work to identify where we can make potential savings, as we've done previously, and also consider the timing and prioritisation of the 3 strategic reviews that the IJB already agreed. And central to all our saving proposals will be impact assessments, including EQIAs in line with our statutory duty, and this should help inform IJB decision making. And then really the final recommendation is an ask of the IJB members that we take more time in our development sessions and maybe have additional sessions just to allow the level of discussion that we feel is required, just to shape the future recommendations that we would look to bring for decisions at the future IJB meetings. That's it. Thanks.
Okay, thanks for that, Frances. Any questions? No questions or comments? Oh, Lisa Marie. Lisa Marie.
Thanks, Jennifer. So I'm really pleased to see that our discussions about the visibility of savings has been reflected in the papers. I think there's been a perception that social care, and particularly learning disability and all those people's services have been targeted. And I don't mean targeted in that it can sound very negative. That's not what I mean, but just that those are the ones that have been looked at recurringly. I do think it's a challenge for officers to have to present quite a big volume of information to us in a way that's understandable. But I think it's important when we're taking these decisions, which are difficult and kind of significant impact on people's lives, that the public see that we're looking at everything and that's influenceable, that we and they know what is and isn't. And there's a fair consideration across services. So I just really welcome the commitment within a big discussion about that, and I think it's really important. And lastly, I really support the additional development sessions. These are big decisions we're making and none of them are easy anymore. I think we need to be taking the time to do it, and I would much rather spend another couple of hours every session discussing these things than be making decisions and not feel comfortable about it. So I really welcome that offer from officers and I support it.
No, I wholeheartedly agree with that, Lisa Marie. You know, I mean, I think our last development session was testament to that. We ran on for an hour and I think we could have spent another 1 or 2 at it. So absolutely, I welcome that. Michelle.
Thank you, Chair. It's just to ask if there are any timeframes around the next steps. Obviously, the steps are highlighted there in section 7, but given the length of time it takes to come up with the proposals and go through the various processes required, do you have any thoughts around timescales for the steps?
I can come in on that. Work has already started to look at the influenceable spend and the budgets. We were hoping to confirm the new membership in terms of the NHS GGC non-exec so that we could include them in the next development session, but certainly we're looking as the summer period can be quite difficult, but certainly August we were going to try and look to get a session in, but the timelines are exceptionally challenging and that is highlighted in the risks.
Fiona.
Thanks. I just want to reiterate, I suppose, what Lisa Marie was saying in terms of this is a really positive way forward, and I know that the process up to just now has been really difficult for the staff involved and all the work that was put into what was done, but also difficult for anybody that was involved in the whole process in terms of people who were receiving services. And I think from being a member myself, it would be helpful to look across the whole portfolio of services so that we can see what are the options for us. So I think the paper's really good. I like that we're learning, you know, lessons learned as we're going ahead. And it was really just to acknowledge the work that had been done before. And I'm happy to see that the way forward looks like it's going to be an easier way to navigate, I think.
Thank you, Fiona. I appreciate that. So we just move to the recommendations. John, sorry.
Thanks, Chair. Can I just say as a leaver and echo what Fiona has said previously, which is to look across the whole range so that those who are on the receiving end of these cuts are not thinking that it's them alone. I mean, that was an issue and it came up. But also to say that what Francis is suggesting in terms of these development sessions is that we did have many developments, I think we had 5, and we thought we were moving through to a point of where, and then of course we had a misunderstanding between the elected members and the health board members, which is ended up in the tie and then the other vote on the emergency that was in this council chamber, is to be quite clear about what it is we're exploring together, because the elected members have got the difficult task of relating to their constituents who see them as representing them wholly in terms of what is coming down the track. And if coming down the track involves change and the change involves them, then it's very difficult. I put their hat on. I say it's very difficult then to say, I have to say to you, constituent, that we're going to have to find some efficiencies here, and that's going to involve change. But it's so that we in council, in our own council, are quite clear what it is we're actually doing and what we hope to get done between the 8 of us, rather than that we come to a kind of stage where we were disappointed, and no doubt the elected members were disappointed too, and we get the public listening in and thinking it's a win or a lose situation when it's nothing to do with winning and losing. It's to do with finding, with the skills that we have as health board members, but also as elected members, the skill that we have of dealing with people and dealing with political situations of this sort, and that we work that through, and that's what comes out. Otherwise, we certainly are going to be escalated. And if we're escalated, it means that the pause button is pressed and we can do nothing in the way of incremental services to our population. Sorry for the...
No, that's all right, John, that's fine. And Linda.
Thank you. Just to kind of cover it from the parents and carers point of view, because I kind of get that's where we're going to the emotional side of it. Initially, our concern was the way that the I keep going to say consultation engagement with the HSCP was carried out. We had no means of redress other than going to our elected members. There's no accountability for the man in the street with the operations that go on within the IJB unless we can take it out with the IJB. We had no opportunity to speak to the IJB members, and maybe that's not what their role is. I don't understand the whole setup there, but our only redress in that case was to go to our elected members and petition them on our behalf, because we were not engaged with properly, we were not engaged with appropriately to some extent, and I feel that was where we were let down. It is very emotional. It still annoys me to this day, the way things were carried out, but that is my personal, and I can see both sides as working as a social care worker. I see both sides of the coin, but I feel that hopefully the HSCP and their officers have learned from the last engagement processes, give us more time. I mean, to get papers on a Friday for a meeting on a Monday, we're carers. Our loyalties are to our loved ones who we care for. We can't possibly make these meetings. And if the HSCP officers think there was not many people engaged with, not people turned up, they've got to take that into account. So, yes, I totally agree. If we've learned lessons from this, hallelujah. If they haven't, they're going to meet the same again.
Well, that's still saying, isn't it? If you don't learn from your mistakes, you're doomed to repeat them, aren't you? So thanks for that, Linda. Any other questions or comments? No. Right, let's get down to the recommendations. So to note the current programme position in section 4, to note the update provided on ongoing activity previously agreed by the IGB in section 5, note the summary of programme risks and challenges set out in section 6, and approve the proposed next steps for sustainable futures laid out in section 7. Okay, all agreed. That takes us on to item 8, which is a draft annual performance report. That'll be yourself, Frances.
Yes. That's me again. As the chair said, this paper presents Renfrewshire's 23-24 annual performance report for approval today. This report, which is a statutory requirement, follows the same format as last year, structured by our 5 strategic plan themes, and it sets out our progress against the key performance indicators within our scorecard and also the delivery of year 2 of our strategic plan. I think also importantly, it features case studies, service user feedback and staff feedback, which I think allows a richer picture of how the HSCP is performing overall. But as with previous years, we have also provided the full performance scorecard as an appendix of the report, and that just allows an overview of our performance as a full HSCP. In the cover paper of this report, we've tried to provide a synopsis of the performance against both the scorecard and year 2 of the strategic plan, which are both generally positive, and I think particularly given the really challenging operating context. So I'll just briefly touch on key points from the paper. In terms of the scorecard, there's 48 indicators that are included, and that's they were agreed by the IJB. We've got 28 with targets and 20 for information only, and we've included the RAG indicators. So we've got 13 that are green, 8 amber and 7 red. Which is slightly amended from your paper, as we got updated information in children vaccinated against MMR, which we're pleased to report has moved from amber to green in Q4. So we're now sitting at 96.3 against a target of 95. So that will be reflected in the updated report that we publish. So although we can't actually provide a comparison to our last year's scorecard, as we've done some work, as members will be aware, to review the indicators and make some improvements. But there are some key improvements in performance that we'd highlight. Obviously, Christine, as part of the Chief Officer update, already talked about our #1 position for standard delayed discharge. But we've also seen, I think, reassuringly, some real positive improvement around areas that we identified as areas of focus in last year's annual performance report, around service waiting times for psychological therapies, primary care, mental health, and alcohol and drugs. And while all of these aren't necessarily green, they've all improved and they're all going in the right direction, which I think is testament to the services that have been really working hard to improve these. And also, I would highlight our new anticipatory care plans, which I should point out, will be called future care plans going forward. They exceeded the annual target at mid-year, so that's fantastic work. And that's a lot of that's been down to the working group that we established to focus on this. But we do recognise that there are areas where we need to continue to focus and to improve. Sickness absence rates for both the NHS and Renfrewshire Council staff remain below target, but I would highlight that both have improved on last year's performance. And also, we noted that our new adult carers supported has decreased. But one of the observations I would make is that the rates have actually, they look as if they're going down to pre-pandemic levels. And during the pandemic, we did see a large increase in the number of people that were seeking support. However, some positive news around carers is that the number of support plans that we're completing has increased, so that the carers that we are working with, we believe, are getting better support.
Yeah, noted that.
Yeah. And sorry,
what did you say?
So I just wanted to finish by saying, in terms of the year 2, the strategic plan, we had a really ambitious plan with 100 deliverables. So we're really pleased to have 82 of those either completed or on track. And there's been some real successes with our telecare team being awarded the Platinum Award. We've had really significant financial gains for families in the early years healthier, wealthier programme. We've identified 59 carer community champions. So lots of positives that you'll read in the report. There are a number of areas that are delayed due to capacity issues, such as our autism action plan, our dementia action plan. So they are firmly in our sight to progress over the coming year. But there are a number, you'll note in the report, that are out with our control, such as NCS, which we'd obviously put an action in to ensure that we deliver on that, but that's not progressed as planned. So that was all I just wanted to give a flavour of the report, as there's too much to go through in detail. But if it's approved today, we'll publish it as required by the end of July, and we'll share it also with the partner organisations. Thanks.
Thank you, Frances. There's some really good information in here. And I know we spoke about the pre-agenda. It's a shame that when it came to the amber, because you literally missed out a point or two from getting it from amber to green, you know. So, Fiona.
Thank you. Just again, comment on the number of indicators where we're doing really well. And I think we have to acknowledge that. Things are very difficult for people just now. Also want to comment on the prescribing indicator. And really, for what I've read, it looks like things have settled down a wee bit, just in terms of that. But I suppose I'm wondering, how confident are we just in terms of saying that we're at pre-COVID potentially levels? But I suppose I'm a bit edgy about that, because a significant part of our deficit is linked with the prescribing activity. And my other question just is in terms of the telecare and the community alarms and the decrease of the clients aged 75 plus receiving telecare. And it kind of indicates that they've moved from an enhanced rate to something that's community alarm based, and I wondered if there was an affordability or financial reason or consideration for that. Thanks.
So in terms of prescribing for the current financial year, it's really early. We don't have much data yet for 24-25, but I do share your concerns because I don't think it's going to go back down at all. There's a lot of pressure on that budget. There's a lot of work being done board wide, and Stuart sits on the same working group that I do as part of Sustainable Futures, and we're looking at our own local plans, but that won't deliver huge benefits. But on top of that, there's also board wide plans that we're linked into as well, in the hope that that will deliver some savings. But again, we're at the behest of the market, and it's far too early in the financial year yet to know which way that's going. And I'm also nervous if I come to the IJB and say, this is where I think it will be, and then it suddenly moves. So I'll be flagging that up as huge caveats throughout this year, but it is an area that I am very concerned about, but we're doing whatever we can locally and within the board to manage that. But there is a limit to where we are. And I think it's quite important to note that Greater Glasgow and Clyde is actually one of the best performing in terms of the average cost because of the various different streams that we have in place. So we've actually got not that much wriggle room to actually bring those costs down, but it's definitely, it is not off anybody's radar. It's really being pushed from every angle. But again, it is the market that we're, you know, at the behest of, as I said. But I share your concerns, Fiona.
Karen's online. Right. Karen, can you come in and answer the concerns about community alarms?
Yeah, I can pick that up. It was just to say in terms of the decrease in 75 plus receiving telecare from 23-24 compared to 22-23. We have gone through that whole switch over from from the basic to enhanced telecare, and we did see a bit of a change in that. Some people had got their alarms when they came out of hospital initially, and folks were feeling actually at the point when we were going in and reviewing that they no longer needed an alarm or they hadn't used it. So that saw a bit of a change. The other, what I can do is I can go back to the service and get a complete breakdown and share that with folks so that everybody is able to see what that is. In terms of the funding, there hasn't been any real change to the funding, so it's not been as a result of an increase of funding. But again, I can get all of the detail around that to reassure members that it's not been in relation to a decrease, you know, people feeling that they can't afford that service, because we would support everybody around their finance when we're looking at putting services into people's homes. But if it's helpful, I'll get that broken down further.
Okay, that's great, Karen. Thanks for that. If you just circulate that information, we'd really appreciate it. Okay. Any other questions?
No problem.
Yes.
Just to follow up on what Karen was saying, the move in the telecare from analogue to digital was a big piece of work, and a lot of people who had telecare systems in due to previous, perhaps their mother who had passed and things like that, was an opportunity for us to look at what tech was required, what was support. We also do a lot operationally. We'll now get Alexa, we've got mobile phones, we've got various things like that. So we're trying to support people to be as independent as possible. So those who need the telecare service receive the telecare service, because obviously that comes with response times and things like that. So it's to make sure who needs it gets it.
Excellent. That's very helpful. Thanks. Ian McMillan.
Okay, thanks very much. Quite a good read, this report. Some terrific work going on. And as Fiona had mentioned, it's just a shame you miss out some of the targets just by a small margin. But you'll probably not be surprised. I'm going to concentrate on kind of a couple of areas of concern. One is always a kind of area of concern for me in social work, kind of health-based staff, is the high number of absences. I know it came down slightly, and that's to be commended, but it's still the average person. I'm only talking about the average person has 4 weeks off a year. Now that's an awful lot. I know some of the council services are quite high as well, and I always worry about the amount of pressure people are on in these particular jobs as cuts start to bite and there's less and less people doing more and more work. sometimes it's just the easy option to go on the 6. Sometimes people don't have any other option because they just can't take any more. So I'm concerned about that rising. One, for the individual who's off sick, but two, for the service as well, because the service can't operate if people are off ill. The other issue I'd like to raise is the A&E waiting times. Speaking to people, been speaking to a lot of people in the last wee while, obviously been involved heavily in the general election campaign, and health is the big issue that you're hearing. Turn the clock back and you very seldom heard about health when it came to elections, but it's a really, really big issue for people at the moment. And just in Monday in Johnson, I heard somebody saying had an absolutely terrific experience with the NHS up at the RH, and everything went really, really well. But there's still figures are concerning about the wait time accident and emergency. So I suppose my question is this because people are referring themselves to accident emergency with relatively minor issues rather than having to go through the gauntlet of trying to get a doctor's appointment, which can be not all the time, and I know there are some improvements been made recently in some practices, but sometimes it can be very, very difficult to get through to your doctors. So sometimes people might take the option of just saying, to hell with it, I'm just going to go to accident and emergency and I'll get seen up there. So does that reflect and why, or does it affect why the figures are still relatively high in terms of waiting time? Thank you.
Yeah, there isn't actually any evidence that people turning up at A&E are turning up because they can't get a GP appointment. And actually the people who are admitted or staying in A&E, there's a higher rate of conversion to admission from the people who attend than there was previously. So there is definitely a greater acuity of people who are turning up at A&E. I mean, clearly there are lots of alternatives like minor injuries units that aren't the A&E front door or kind of don't involve the A&E front door. But I think that there's no suggestion and there's no evidence that the reason A&E and the hospital is busy is because primary care is not accessible. All of that being said, do we strive to have better access, better routes for people to access primary care? Absolutely. Have we got a workforce challenge in primary care still? Yes, absolutely. But I know we're going to come on to the primary care strategy, and I think some of the digital solutions, hopefully down the line, will kind of support that. But I think it is important just to really be clear that the issues in A&E are not due to or directly correlated with access to primary care is the main issue. That's multifactorial and to do with flow in the patient flow in the hospital and acute sites as well, and nowhere to put people in a bed, I think, once they've a decision's been made to admit them.
Well, maybe if I can pick up the attendance questions that you raised there. So we are concerned about our attendance. I suppose we've discussed this a few times before, that some of it is not a surprise to us in terms of our workforce who worked right through the pandemic and the impact of that. So many people were, stood down in terms of the pandemic from services, but generally not in health and social care. So we're aware of that. We've got a number of action plans across our NHS staff groups, but also council. But I would also remind the IGIB today that within Renfrewshire, we have got 7 mental health wards. Some areas don't have any inpatient wards, and you can imagine that that's quite a intensive service to work in. And we also have a couple of large hosted services, so they do impact on, they're included in our figures as well. But we are absolutely aware of this, and we're looking very hard about how we reduce this, and most importantly, how we support our staff to remain at work, to remain well. And there are a number of initiatives around supporting staff's well-being. So we are, all of the head of service, we had another discussion about it last week about very specific actions about how we support people to stay at work, but to stay at work well, and how we get people back as quickly as possible, because we also know that when people are off, that impacts on the staff who are remaining in work. So we're absolutely aware of that, and we're hopeful that over the next couple of months that we'll see those numbers coming down.
John Matthews.
Thanks, Chair. On the subject of technology helping our services, I chair the Public Engagements Committee of Glasgow's Integrated Joint Board. And we receive reports about this technology and its advance and how it's advancing and how it's being received by service users. We had one this month, and I just wondered, is there an exchange of because Glasgow's quite big, and so it has a lot of resource to be able to work with, and I just wondered if there was any sharing one way, but also sharing the other way towards us in helping us to understand and not reinvent the wheel.
In terms of the analogue to digital, in actual fact, Renfrewshire is far in advance of many of the other partnerships because we started it long before. So today Glasgow's lagging behind us on this one, but it's a, but I think we were just one of the first to start, and actually it's just as well because it's got even more expensive to implement since when we started it about 3 years ago. So we're at the end of that journey of moving from analogue to digital, but there's always lots to learn from other people, so we can always look to what they're doing.
It was actually brought to my very first pre-agenda in 2017, analogue to digital, and how much it was going to cost. That first meeting we walked in with you and David Leeson and the whole crowd. That's what we're discussing. Lisa. Lisa.
I'm going to take the credit for that one, John. That was my project. And many others. No, we did. We do. Yeah, and that's you knew that, didn't you? Yeah, absolutely. We do have it. There is a digital network. It's where all the areas and all the teams come through and they discuss what's working well, what's not working so well. And it was a lot of teething problems to get to where we are. So there's a lot of learning going on from that. And we still continue to learn. And as Sarah's saying, we are a bit more advanced in some of the stuff. So we've experienced outages, we've experienced all sorts of things with it. So it's been good learning and good development. But we do absolutely collaborate with the rest of the areas in GGC wide.
That's great.
And that's great because I remember I'm 8 years on the board of GGC, and we were scary, and the patients and the service user were very scary about the idea that we would change, and what a change it is in terms of where we used to be 8 years ago, in terms of people phoning their doctor and so on and seeing a human being to be invited to do things differently. And of course, here we are along this road, and you obviously want to share that in terms of how you overcame these kinds of nervousness and anxieties.
Super. Right, great. Any other questions or comments? Well, good. Right, so we'll go to the recommendations to approve the draft annual performance report for 23-24 and note the draft 3-year strategy strategic delivery plan, and note the update of the draft scorecard for 24-25. Okay, so if that's agreed, we'll go into item 9, which is the strategic plan for 22-25 3-year delivery plan and proposed review.
Yeah, that would be myself picking this one up, Jennifer.
David.
So this paper follows on from the APR which we've just considered, which looked at year 2 performance of the strategic plan, and it covers the proposed delivery plan for year 3, covering the period up until March 2025. So section 4 of the paper describes the approach that we followed in developing this year's plan, and it includes the testing of proposed priorities with our strategic planning group, which we undertook in May. In developing plan, we've also reflected the wider challenges that we've spoken about this morning around finance and staffing capacity and the nature of the deliverables that we have identified. And as such, we feel that the deliverables within the plan are achievable within that context. The paper also gives examples of objectives which had previously been paused during years 1 and 2 of the plan, but are now included in year 3. It gives examples of the new deliverables which we have added also. And it also includes examples of those deliverables which have been discontinued or revised due to other external factors, and that's now reflected in the plan. The second part of the paper, in section 5, also sets out a proposal for the IGB's consideration today in relation to the review of the strategic plan. So the Scottish Government's guidance notes that plans must be reviewed every 3 years, which would mean that we would be commencing work on that review shortly. but within that guidance, there's not a requirement to create a new plan as a result of the review that you undertake. The IGB's current plan, as you'll know, runs until March 2025. However, we feel that the themes within the plan still remain highly relevant beyond that point, and we're also aware there's a lot of uncertainty in the wider policy environment that further clarity on would be helpful. And as such, within this paper, we're proposing that rather than develop a full new plan, that we review the existing version with a view to extending it by a further 2 years until March 2027. Pending the IGB's approval of that proposal, the paper also describes the proposed approach that we would take to undertaking that review, and an update on progress and a draft updated plan would be brought to the IGB in November prior to a consultation process and agreement of the final plan, updated review of the plan in March 2025. Very happy to take any questions.
Crikey, did you not hear that? Do you want me to go over that again? Right, okay. So, to note the progress undertaken to develop the 3-year strategic delivery plan, approve the contents of the strategic delivery plan provided in Appendix 1 of the paper, and approve the proposed review of the refreshed existing strategic plan for a period of a further 2 years to March 2027, laid out in Section 5 of this report. Okay, agreed? Agreed. Item 10 is update and joint inspection for child at risk and harm.
Yep, that'll be me. Thanks, Chair. So members will be aware that we're in the middle of a joint inspection for children at risk at harm within Renfrewshire area. So we received notice of this on the 8th of April this year, and the inspection will run from the 8th of April 2022 to 8th of April 24. So currently we're in week 10 of the inspection, so we're bringing a short paper here just to give you an update on where the progress is to date, and note that further updates will obviously be brought back to the IGB. So there was only a couple of things. Obviously the paper's quite short, I just wanted to pick out. So today there's been a number of things completed, given that we're nearly halfway through. The staff survey was completed, and that it was an inordinate amount of engagement work with all the staff that would be involved, and that's across all services. So council, HSCP staff, police, education, and third sector organisations, to ensure that they knew that we were really looking for their engagement with that survey. So that ran for the month of May and is now closed. There was a huge amount of coordinated effort to gather all the records that were required across all these organisations, and I think credit has to be noted from all the staff that were involved to be able to do that. So file reading week was in the 17th of June. We are now looking towards the position statement, which will be finally drafted after a meeting next week, which is Partnership 2 meeting, and that will give us some initial feedback on the results of our survey, as well as some initial feedback on the child record review as well. So moving forward is Engagement Week, which is the next big week on the 19th of August, where there'll be many focus groups that inspectors will looking to meet with staff, managers, children and families who have been through this process, to get a full view of how we keep children at risk from harm. And we expect the final report to be completed by the 22nd of October. So we'll continue to give further updates, and if anybody get any kind of other points of clarity or questions, I'm happy to hopefully be able to answer them.
Okay, thanks for that. Do we have any questions? No, well, okay with that. Can we agree to note? Oh, sorry, Fiona.
It's just a comment rather than a question, and it's just to kind of acknowledge the amount of work that goes into these inspections from everybody. It's quite intense, and it can be quite nerve-wracking for people. So really to acknowledge the amount of work that's going on. Thank the staff for doing that. Thanks.
Thanks for that, Fiona. Okay, so we agree to note the report on page 199. Agreed. That takes us to item 11, which is the NHS GGC Health and Wellbeing Survey.
I think Francis is going to do a short.
We've got Anna Baxendale, Head of Health Improvement, on that will take us through this paper. That's okay.
All right.
Thanks, Francis. Hi there. Thank you. I'm not going to go through the report in a lot of detail because I guess I just want to acknowledge that the IJB development session received a detailed presentation from Alison Potts in relation to that, but also to recognise that the Community Planning Partnership has also received a recent presentation of similar data and similar information. I would just like to highlight the next steps that are outlined in the paper in terms of further engagement, working with Engage Renfrewshire, in terms of including local lived experience panel experience as part of the development of the Renfrewshire response to the Director of Public Health report, but also just to recognise that both the IJB and the Community Planning Executive are going to receive regular updates in relation to the Renfrewshire response, and that will be integrated with the local strategic plan that you've just discussed. I hope that's okay.
Absolutely. Just to say, I actually got so much out of the presentation we were given the development day. I really enjoyed that. I could have taken a whole session on that, to be honest. So any questions or comments with regards to, Councillor Hughes, Lisa Marie.
Thanks, Jennifer. I just really wanted to highlight that it's a really excellent and fascinating report. I'm like yourself, Jennifer, I was really absorbed by it. I'd asked Dr. Potts several questions at the development session, and she said there's even more coming, and it'll all be in the report. And the answers were in the report, so I'm pleased. But I think it's really crucial data in terms of both kind of the quite specific areas and then the broader population. And I was particularly interested in the section around children's health. At the beginning of section 4, there are several points in that. Because I think if we can improve children's health, we improve their quality of life for people generally, but also reduces pressure on services. So for us, I think there are lots of areas in which we have to do things to reduce the pressure on acute things. But I think supporting children to be healthy from early life is proven to be good. And this is a big question, and it's probably for officers. Office, and you may not be able to answer it. So if the responses will bring you some stuff back, then that's fine. But I guess what I'd quite like to know is how we are going to use the data to ensure that we're doing the very best we can with our already very good services. And if that needs to come back as a paper or be part of a development session, I'm happy with that. But I think it's really crucial that we understand the train of data into how it's improved and how it's implemented in services. So sorry, that was a big blethering question, but I just think it's really important we understand how it's being used.
Absolutely. Right, I'll bring in Francis.
Absolutely. We will look to use this intelligence in a range of ways. It's the first real meaningful intelligence we've got sort of post-COVID. So as David had mentioned, when we refreshed the strategic plan, it's intelligence like this. And we've also got the new census, for example, as well, that we would use to inform. I think particularly given the financial climate that we're in and the resource constraints that we're operating in, we do need to look at prioritisation and targeting, and this will give an evidence base to help inform that. Another example will come on later to our equalities plan, and that's something as well with both the information in the health and wellbeing survey and also things like the census, as we have evidence of maybe increasing diversity in our population, or also where we're seeing inequalities in certain groups, that we can actually target that more. But just also to highlight, there will be a wider community planning response. This was well received by our community planning partners. The HSEP Health Improvement Team working with NHS GGC will lead on work with the partners, but we made it really clear that this, as the reports do, that this needs to be a Renfrewshire-wide partnership response. And there's a lot of additional intelligence that the council, third sector and others have alongside getting that additional insight from the lived experience panel and others that I think we can pull together to inform a response and the community planning priorities as well. But I think a lot of them, children, child poverty are already at the heart of those, but it's an opportunity to review them in light of the new information. So
thank you for that, Francis. I thought that was a question, Ian, but it's just scratching your heads. Right, okay then. So no other questions or comments on this. Okay, we'll just move to the recommendations, and that's acknowledge the health and wellbeing position for the Renfrewshire population formed by the Adult Health and Wellbeing Survey 2024. Use analysis and calls to action within the NHS GGC Director Public Health Report within planning structures and capitalise on the available opportunities to improve health. And approve the proposed next steps for Renfrewshire's HSCP to work with community partners to develop a response as a local survey, finding a wider calls to action. Okay, all agreed? Great. Right, that takes us on to item 12, which is the NHS GGC Primary Care Strategic Implementation Plan.
So I'll just say a few words by way of introduction. As IJB will be aware, Renfrewshire host primary care on behalf of the Health Board, and I'm the lead Chief Officer for primary care on behalf of the board. So I'm absolutely delighted that we have developed the board's very first primary care strategy, and you have that in your pack. And that was approved by the Health Board at a recent meeting. Alan Stevenson, Director of Primary Care, and Anne Forsyth, Head of Primary Care Support, are here just to briefly present the paper and provide any answers to any questions that you may have. So I'll pass over to them.
Good morning. Thank you, Christine. Good morning, Chair, and thank you for giving us the opportunity to briefly just speak to you about our new strategic plan. As Christine said, we're very pleased to have our first plan been signed off by the Health Board at the end of April. We're only the second partnership to have a plan. It's quite a complex and dynamic piece of work in relation to just where primary care sits in the kind of system, the whole system. And this strategy is probably a bit more challenging than a lot of other strategies because we have to try and influence and direct the system that we work in, as well as taking forward the pieces of work around the strategy. We have a very in-depth implementation plan we've also developed since the strategy was signed off, and Anne and I are due, and Christine are due to go back to the board next Thursday back to CMT to give them an update on exactly how we're planning to take this work forward. It's a good time to have a strategy. The pressures in primary care, and I mean across the primary care family, are quite intense. We have issues around population health, we have prescribing pressures, we have workforce challenges, and just as a reminder, around about 80% of the NHS business is around the primary care family, and we have over 20% of the budget. So it is a really significant part of the NHS work that we do. Under 3.6 of the plan, it talks about sustainable workforce, about our work in relation to digital technologies and having well-connected services, including signposting. So a very thorough, I think, strategy which really puts us in a good place to take on the challenges, because there are significant challenges for us, and I think having a strategic plan puts us on a really good footing within the Health Board and across Council and IJBs. It really does put us in a place where people can ask, how are you making progress? What are your priorities? And how are you going to get there? So really, Anne and I would be more than happy to take any questions, Chair. Thank you.
Thank you for that. Do we have any questions? Nope, I think you're getting off lightly there, but thank you. Right, if we go to the recommendations, note the contents of the report and its appendices, receive an annual update on delivery of the programme. Okay, so that's agreed. Right, next items, item 13, equality outcome, mainstreaming progress report and consultation and equalities outcome. Is that yourself, Francis?
Yeah, that's me. So in line with the IJB specific duties under the 2010 Equalities Act, this paper presents our equalities outcomes and mainstreaming report for the period 2022 to 24. And it also asks members to approve our new equality outcomes for the coming 4 years. So this outcome and mainstreaming report follows on from the mid-year report that members received in 2022, and it sets out the progress over the last 2 years against our quality outcomes, but also the highlights of the activities that we've been doing to support mainstreaming and across Renfrewshire. There are lots of powerful examples in the report, and I just wanted to add that we are going to get it graphic designed. I think it then might assist pull out with photographs, because there is some really, really good work there that we would want to promote. I mean, just wanted to pick out a couple of examples. We had a working group established last year along with our partners, Scottish Care and our partners in the independent sector, to look at racism issues in the care at home sector, where they've done surveys, a lot of engagement work, and this has resulted in a common shared approach across both the HSCP and the independent sector to this. And we've been carrying out a range of training both for managers and for staff, and we've also now developed a joint policy with Scottish Care to address racism, and that's going to be launched in August. Another really good example, because it highlights the sort of broader health equalities with children, but also specific around BAME communities, is the work of the Health Improvement Team to support the Healthier, Wealthier Children service and incomisation. And we've seen specifically in relation to families from ethnic minorities, the referrals double, and there's been some really good work done with the INREN service that Engage run, Pashadu and a number of others to try and increase the referrals from that specific group. So section 5 of the report, as I'd mentioned, sets out the 4 new equality outcomes for the coming 4 years. These were developed in consultation with a number of stakeholders, including our strategic planning group. So we had time with the members of the group to discuss and get their feedback and shape them. Also the DEAR group, which is the Diversity and Equality Alliance in Renfrewshire, we worked with them. And we had some other sessions with different community groups, and we also had a survey, and it was also informed by a range of local and national reports. So in terms of next steps, subject to members agreeing this today, we just want to reassure members that equalities will remain a priority, and that the action plan that we've attached in relation to taking forward the 4 outcomes will evolve, and it will reflect new intelligence and insight. And that's just what I'd mentioned previously in relation to the health and wellbeing survey, that we will look at that and recognise that those that are affected and disadvantaged may fall under the protected characteristics. I think also, as I'd mentioned earlier, the census, the last census was 2011, and we are anticipating that the diversity within the local population will have increased significantly. And linking back to the health and wellbeing survey, with 45% of people that had experienced at least one type of discrimination in the last year within Renfrewshire. So it needs to remain at the forefront of our minds. And then I guess a critical point, just picking up on sustainable futures and the conversations around finances and how we look to address our budget gap. We must take account of the Fairer Scotland duty, and that places a legal responsibility on us to actively consider how we can reduce inequality of outcomes, which is a real challenge as we try to balance our budgets. But we need to make sure that we take account of that and also adopt our qualities impact assessment process as well when we're making strategic decisions. So that was all I really wanted to give my highlights.
I believe Lucy Marie, get your hands up. Come on in, Lisa.
Thanks, Jen. Yeah, I'll just be really quick, just to say that I was really interested to hear you talking about the anti-racist work, Francis, because that's one of the things that stood out as a highlight to me in the document. And obviously it's clearly particular work for a specific partnership, and I think that work with Scottish Care, so that both our public, private and full sector are all kind of singing to the same hymn sheet, and that people who have got intersecting care services are getting, it's the same approach all the way across. I think that's really important. I suppose I just wanted to offer with a different hat on that if there's a look across broader services in the future, and I think there's probably a very positive link through one when we're doing really significant anti-racist work around the museum project, but in the wider team, and I know you meet with Victoria pretty regularly across lots of other things, but may not have been aware of that work, so I just wanted to offer that really. I think it would be really valuable to use the skills we already have. We've got lots of specialists in this, so just that offer's there, and I'm sure Victoria would be delighted to talk to you about it.
Okay, thank you for that, Lisa Marie. Yeah, all right, sorry, you're next, Fiona.
Thanks very much. Really interested, I think, in terms of equalities, looking at the implications just now of the number of people who are diagnosed or we are aware that are neurodiverse, and I see that in your action plan. I know certainly from a third sector point of view, in terms of employed people, where that's an issue for them, it's a difficult thing just now. We're still trying to kind of locate our way around what does that mean in terms of practice? What does that mean in terms of support? And with neurodiversity, each individual person's different in terms of how you support them. And I think it's particularly interesting, given that in the care sector, the majority of the people that are employed just now are female, and they might be over 50s. And if we're looking to attract younger people to replace them when they move on, I think we need to learn a lot about how do we support people who are neurodiverse.
Yes.
Because I think it's a big up and coming issue for us in terms of employment. So for me, it's really helpful to see that on your
Thank you, Fiona.
document and action plan. Thanks.
Ian's next, and then yourself, Linda.
Okay, thanks very much. I thought this was a very interesting report on a number of fronts. One is the changing diversity of our population here in Renfrewshire. It's quite incredible, the changes that have happened in the last 10 years. And I think we as an organisation, whether it's the Health or Council, have embraced that change in diversity. Okay, there's one or two people, as we've seen highlighted in the news, have got extreme views about people of maybe a different colour, a different sexual orientation from them, but thankfully they are really in the minority, and I think we've got a proud record of here in Renfrewshire. But that does bring some issues, because very often people that come to this area, are socially isolated, tend to be in lower paid jobs. So they do bring some issues as well, but I think we're up for the challenge of that. Certainly was noted the information in the British Sign Language. As you'll know, Councillor Janice MacDonald from the Labour group is particularly strong in this, and she's certainly educated all of us, I think, on the importance of British Sign Language. So I'm glad to see that's been in there as well. But I suppose that the biggest thing for me in this is the kind of priority for loneliness and social isolation. I think this is a big, really big issue as we move to more people being on their own, and we see that in statistics about housing, the number of people who actually live on their own. Now, for a lot of people, that might be a lifestyle choice, but for an awful lot of other people, it's not, and it can bring with it an awful lot of issues. It can bring dietary problems, alcohol and drugs problems, and just the general feeling of just being alone. It's no good for your mental health. And certainly, I was listening to the radio yesterday. There's some evidence to find that people who are socially isolated and suffering from loneliness are more likely to suffer from strokes, which I hadn't really thought about before. But once the programme and the radio was finished, I gave it some thought, and it all kind of made sense. So, as I say, I think this is a very good report, and it's fairly honest about the challenges that we face here in Renfrewshire, and in particular in the key facts, point 1, 2, 3, 4, 5, about the number of people who we have who are kind of long-term sick as well, and that's quite a scary figure for us here in Renfrewshire, and again does bring lots of challenges for the Health and Social Care Partnership. Thank you.
You're absolutely right about isolation and loneliness. I mean, it is one of our priorities in the council and the HSEP, and I'm pretty sure, I'm not just making this up, I did read it somewhere, that it's on par with smoking, because as you say, for all the reasons you mentioned, you probably don't eat right, you probably don't look after yourself, and you don't have somebody else there to look after. I know when my daughter's at her father's, I tend not to feed myself as much as I would when she's there, so I get it. If you're there by yourself all the time, it would come in a array of problems then. Okay, any other questions or comments? Yes, Laura.
Chair, you remember I sent you last year an episode of The Piano.
Yes.
And
Totally enjoyed it.
members may well have seen the first, and it's had a second series.
Lucy?
And Lucy
Yes.
was a 13-year-old girl who was blind, who couldn't conduct a conversation with you, and she played Debussy.
That's right.
It was thrilling.
It was phenomenal. Laura.
But that shows you the
spectrum, absolutely.
Thank you, Chair. It's just coming back on a point that Councillor Riley Nicholson had picked up in relation to neurodiversity, autism and employment. Just for noting that through the Learning Disability Planning Group and the Autism Planning Group, we have employability sitting as partners on those group. And we're doing some really, really exciting work through the local employability partnership. And we have HSEP officers chairing some of the subgroups. So we received presentations recently, and I just think for noting that there is some work ongoing, and it is a group that we are targeting to support in partnership with the LEP. So just for noting.
Thank you, Laura. That's helpful. Okay, so if there's no more questions or comments, nobody online, we'll go to the recommendations, and that's to approve the draft, the Quality Outcomes Mainstream Progress Report and its publication, and approve the refreshed Equalities Outcomes for 24-28. Right, and that takes us on to item 14, which is a verbal update with the IGB Auditors Scrutiny Committee.
Thanks, Chair. We touched on briefly earlier one of the main items, which was our scrutiny of the governance statement and the draft account, so I'll not repeat that. But that formed a fair chunk of the meeting, along with the annual report from internal audit and an update from external audit. We also reviewed the updated risk register for the IGB. The two other main items were picked up on inspection reports. So now we are routinely getting inspection reports. So we've had two positive reports from the Care Inspectorate and the Mental Welfare Commission. So those were updated to us.
Absolutely.
Any questions or
right.
realistically hand to officers to answer the ones? Thank you.
Do we have any questions? No? All right then. Right, well let's just agree the date of the next meeting, which will be held at 10 o'clock, the 25th of September. Oh gosh, it's just been brought to my attention, this is John Matthews' last meeting. John, you'll be missed. Oh no, honestly, you will be. Well, listen, why don't you? Honestly, John, you will be missed. You've been a great, I've learned a lot from you, and I love to hear you talk. I love when you go into it sounds like a sermon when you start. When I was a parish minister in Rakill, but I love it. That's how you always start it. But, listen, we can all learn a lot from you, John, and I have done in the time that I've worked with you. So thanks for your support. Thanks for your encouragement, and all the best. Enjoy your retirement. I would just agree the last week. You got that, didn't you? September. Okay, thanks.
Thanks, everybody.